behalf of virtual veterinary specialists, we hope that you are all keeping safe and well at this unprecedented time. With so much uncertainty about how to deliver veterinary care for our patients and clients, and yet keep ourselves and our teams safe, there is a real need for clarity and workable solutions that can be easily implemented. Incorporating the guidance from the RCVS and BVA over the last few weeks, we have drawn together our initial thoughts on how technology, and in particular telemedicine, coupled with changes in in-practice procedure, can be used to effectively deliver primary and referral level veterinary care both efficiently and safely. At this time of social distancing, remote working and skeleton teams, the mental well-being of our veterinary colleagues is also a very important consideration. From our extensive experience over the last 3 years at VVS, from having daily telemedicine interactions with hundreds of veterinary professional colleagues around the UK, we feel that if harnessed correctly, technology can be an enormous asset to improving communication and collaboration and creating a supportive working environment for the veterinary profession at this time. We have prepared a simple diagram that we hope will be of use to you in your practice to help understand the 3 key elements that need to be considered for an immediate implementation of a new working strategy. The 3 elements are communication with your clients, new in-practice protocols within the physical veterinary practice, and communication with specialist colleagues for second opinion and virtual referrals. To facilitate communication with your clients, there are many different options available now, from traditional telephone calls, text, WhatsApp, video call and video conferencing platforms such as Skype, Zoom and FaceTime, as well as a growing number of veterinary-specific telemedicine platforms designed for vet-to-client communication. These technologies are simple to use and can be implemented easily and used for booking appointments, taking payments, conducting consultations with clients, discharging patients, and follow-up checks. Teleconsultations with clients can also be done by veterinary surgeons working from home to minimise the number of staff within the physical practice setting. This has been helped by the RCVS's temporary relaxation of the guidelines around remote prescribing. If the pet does need to come into the veterinary clinic, strict social distancing requires that the veterinary professionals and the pet owner have no physical contact, maintaining 2-metre distances, and that all the veterinary team are wearing suitable PPE to minimise exposure risk. This can be achieved in a number of ways, but one way that seems to be being successfully implemented is that the pet remains in the car with the owner until the vet is ready to see the pet, and then the pet is collected directly from the car park so that the owner does not need to come into the practice. Some practices have implemented a collection and drop-off service for patients requiring emergency and urgent treatment, again to avoid the need for owners to come into the physical veterinary premises. The guidelines state that only pets requiring emergency and urgent veterinary care should be seen at the physical veterinary practice at this time, with many vets now finding themselves in sole charge, working in skeleton teams, and having to manage these challenging and often complex cases in-house by themselves. This is undoubtedly going to be a source of additional stress for many. This is where telemedicine services designed to enable vets in practice to consult with multidisciplinary teams of remote specialists can play an important role to provide this vital support and case advice. This type of service is easy to access and can enable vets to obtain support and guidance from virtual specialists either through telephone advice, written specialist reports, or through video consultations where live guided diagnostics such as ultrasound can be performed under the real-time supervision of the remote specialist. This enables the vet and specialist to work together to reach a diagnosis and develop a workable treatment plan for the patient, all within the first opinion setting, which is so key at this time of restricted travel. We strongly believe that by embracing readily available and easy to use telemedicine technology at both ends of the patient care cycle, veterinary practices and their teams should be able to stringently adhere to the new RCVS and BVA guidelines while still maintaining a high standard of patient care. Thank you for watching and stay safe and well.